Life moves fast. It's fierce, persistent, determined. At City of Hope Cancer Center, they are too. Their groundbreaking research and discoveries have impacted millions of lives globally. They're moving science forward with the hope, passion, and speed every diagnosis deserves for a cancer-free future. City of Hope, pursuing cancer cures at the speed of life. Learn more at cityofhope.org. Hi, Paul. How are you?
Hi, Jacqueline. How are you?
Good. I think I have said a couple times that sorry, we're doing a giggly intro, but it's just, we have 5 full seconds as it counts down where we're staring at ourselves first. And so we're always very giggly right at the beginning. So I'm going to just stop saying sorry for that, because now you guys can just assume that we're going to be giggling when the podcast starts.
Nothing we can do about it.
But today we have me, Jacqueline, and Paul on the podcast. We're going to be talking about last week's issue, which I will go through briefly now. So Paul had a cover story about a potential new cancer moonshot. And obviously that's sort of a very loaded word in our field, but I will let Paul sort of kind of walk through what that looks like. And there's sort of not a story, but a little bit of a thing to walk through sort of behind the scenes on that story as well. And then we had our second story was a conversation with Marcel Vandenbrink from City of Hope, which was related to story 1. He sort of talks about where we're at in, where the field is at in microbiome research and why this sort of quote unquote moonshot. I don't even know if I said that. Geez, sorry. Story 1 was a potential new cancer moonshot focused on the microbiome, which is obviously the buzzword. It's there's a lot of, again, like I said, context to talk about. And then our story 3 was, a hearing, where not only NCI Director Letai, but the other, NIH leaders appeared before the Senate, the Senate Appropriations, Subcommittee that's focused on HHS and others, but HHS. And they talked about basically the budget last year, payouts of grants, contracts, etc. They talked about, they had a whole discussion. And it was pretty interesting just broadly, but the neat thing for us, I think, was that, we've been seeing that oncology and sort of the cancer world at a federal level has been sort of getting off weirdly easy with things. And like the budget's request, it was the only institute and center in NIH that had a raise when the rest had saw a cut, again, in the budget request. So not necessarily anything stable or certain yet. But we just have this weird sort of thing that's happening where NCI is kind of getting off, and that definitely continued where Letai certainly got off with pretty chummy, easy questions. People were asking about NCI designation in their rural states. It felt very kind of nice and conversational, whereas the rest of the hearing was quite contentious. So worth checking out. Also, a lot of, like I said, important things were discussed that is of interest to our field. So indirect cost caps, et cetera, forward funding, things like that. And then we had a story that originally started as a cancer policy, but it became bigger as they do. It was that 2 USPSTF leaders were fired by HHS Secretary Robert F. Kennedy. And this sort of USPSTF question has been something we've been covering for a while, so please go read that story. But basically, it's just yet another incident of destabilizing this really incredible supposedly or intended to be independent group, federal group that is now becoming rudderless and a little bit, it's just a little scary because we can't really replace USPSTF. And then we had a guest editorial that was incredible. It was about a neuro-oncologist who talks about in a very personal way. It's not sort of a typical it's a very personal narrative story. It's not necessarily newsy as much. And it's talking about him, the neuro-oncologist, navigating the reality of his father's pancreatic cancer diagnosis and treatment. And just, we've heard this story, I think, in different ways, but it's always so important to bring them up again, where an oncologist, even though they are such an expert in treatment and everything, once they are put in sort of either the patient or the caregiver position, their understanding of the reality of their patients really irrevocably changes in ways that I don't think that they could necessarily, anybody could imagine. So it's just, like I said, I say this in almost all of our podcasts. Anytime we can say it is that, whenever we have a human story, a patient story to recenter us, we like to publish it. And then the last thing I'll just say is that Cancer Policy had a story that's trending, and I just think I want to sort of mention it, that FDA's acting drug chief, acting vaccines chief, and chief of staff all were ousted in the wake of former FDA Commissioner Marty Makary resigning last week or 2 weeks ago. And one, I wanted to bring that up because it seems clear that our readers care about it. It's one of our trending stories. And also just in the context of the USPSTF story, we have, I think in this one issue alone, 5 federal HHS officials either stepping down or, well, yeah, maybe that's too broad of a category, but just leadership shakeups at HHS. That's it. So, Paul, let's talk about positive things where things are, where it's moving. Yes.
Yeah, it's kind of interesting as when you look at it all together, that whole issue, which, by the way, we always just let the news shape the stories. I mean, shape the issue. So we had no control over what was going to go in. The gods
if only, right?
Yeah. Well, no, we wouldn't want to. We would have a very different job description.
Yes. We would be gods.
God,
Sounds good.
Yeah. Well, the gods. But the interesting thing to me is seeing the contrast between the FDA story and the NCI story. Because the FDA, you could see the wheels coming off that thing for months and months and months. And in fact, the minute you could see it, for some reason, the wheels have not come off NCI and the wheels are very much on. And in fact, it's kind of moving forward.
Yeah.
And I don't know the story beyond maybe, it might be luck of the draw. Could be just as simple as that. And by the way, this kind of thing has happened in previous administrations too, not precisely in the same way.
Yeah.
Some agencies have done really well, and some agencies have gone into very unpleasant spaces. Yeah. But this was interesting, and actually, I want to compliment you on your story about Tony Letai's testimony, because everybody was kind of hands on, kid gloves. Other people got beat up, as that's normal. That's just legislative process. Kick as much as you want, take a number.
As I was listening to it, I was kind of expecting, we've covered, or honestly, Claire has really been sort of the hearing coverager.
Yeah. Coverager. Sounds like a forager. Rhymes at least with it. Which is appropriate.
Yes, literally. Oh my gosh. Yes, she has foraged into the hearing world. And so we've covered it, and they've just been, this year, to be frank, and again, maybe this is just my naivete and youngness coming out, but this year it seems sort of youth. Wow, there you go.
Youngness is also.
I get it. Well, I didn't mean youth as like a positive. Anyway, it doesn't matter.
Well, your Englishing is getting very interesting.
As I'm getting. I'm drinking my coffee now. Hopefully it will get better as the podcast goes on. No promises though.
The drinkerizing.
Yeah. I'm sipping. No, that's a correct word. Oh my gosh.
Oh my God.
Wow, bad. Okay.
We're moving in the right direction.
Just like NCI, NCI's Letai was, he was there, and I was expecting him to sort of face the same sort of thing that I have seen Kennedy face, or Bhattacharya, et cetera. And to be fair, at that hearing, Bhattacharya got hard questions. And, also to be fair, I think he handled them pretty gracefully. It was a contentious hearing that, brought up these important questions. But the thing that really made me not realize, but like see, I guess, that, wait, this is a little weird that NCI, not weird, I don't want to sound like a conspiracy theorist, but you know what I mean? Like, it's notable that NCI is sort of being, having, again, like he said, almost like kid gloves, where, Senator Durbin brought up the vaping conversation, right? We had a story, two stories about vaping and Marty Makary last week. And basically, you guys can go read that. That's a whole thing. It's a complicated story that has nuance, but basically the sort of lay interpretation of it is that, oh my gosh, fruit flavored vapes are more available to children. And that is, again, not the full story, but functionally for what I'm about to say, that's what it is. And Senator Durbin brought that up to the panel, and he only asked Bhattacharya. Like, Letai did not have to talk about it, which I thought was really interesting because it is not only is it a cancer problem, right, or an oncology problem, Senator Durbin knew that it was an oncology problem. He brought up the fact that it's so related to, like, lung cancer was the thing that he brought up, right? And again, in the bad way, not in sort of the nuanced, complicated way where, vaping can actually help, people who are already addicted to cigarettes maybe move off them, right? That's sort of the other side of things. But it was just so interesting to me that Letai wasn't asked to speak on that when it was so cancer related. And Bhattacharya, like I said, handled it pretty well. It's again a weird conversation because that was really an FDA decision. And so Bhattacharya doesn't really have any say or anything to do with that necessarily, but he handled it, I think pretty, like I said, gracefully. But yeah, I don't know, maybe that's me reading too far into it, but in the context of everything else, it was like, oh, interesting.
Well, he wasn't even asked what's the payout rate. Which is interesting because we had that information. It was in your story.
Yeah. NCI
was not asked on the Hill.
I know.
Why?
I don't know. It's so weird.
It's really odd because your story contained more information than the hearing. Relevant to us, which is fine, which is our job. Yeah.
But still, it's interesting because it is.
Yeah. Because we're kind of looking at this thing. Wait, why didn't they even ask that? Because I know it's a question that's discussed on Capitol Hill because my sources call me, what in the world? And nobody asked. Nobody asked, maybe because you don't ask when you know the answer. Or
maybe that's true. Yeah, that's a good point. And to be fair, I mean, I don't know if this really is fair. This is just but Letai is still like relatively new. And so, it's, maybe they're being nice to, I don't know. That's probably way too much conjecture, but, Anyway, let's talk about, microbiome.
Let's go back a little bit more because it's actually, it could be an interesting question because, I mean, I've covered a lot of NCI directors.
Yeah.
And some NCI directors, make really good targets. People want to kick them. On Capitol Hill.
Yeah.
And other people don't. They don't.
Yeah.
Like, it's just why? And I think Letai is just lucky to be one of the people who our legislators don't want to kick.
Yeah.
Which is, a good hire, I guess. Sure,
it's true. Yeah.
It's but that is what we witnessed, and it was noteworthy.
Yeah. Absolutely. Should we? I know I kind of did hijack the conversation. Let's hear about the symposium, the moonshot symposium. I feel like that's because I didn't even really give sort of the once over on that. Do you want to talk about?
Nobody really expected to hear the word moonshot when they went there.
Well, let's see where, because I'm not sure I actually said what it was.
There is City of Hope put together a symposium on the microbiome, and the objective of the symposium, which was a meticulously organized big thing, political, was to bring together scientists. And by the way, my story does not contain any science; it was just policy. But there was science being discussed. And it was all policy. And RFK Jr. was giving the keynote. And in this keynote, he just said moonshot on the microbiome. But the objective of this whole thing was to start a new microbiome program that would do a massive amount of large clinical studies in cancer specifically, as well as, I guess, other things. As it happens, you can argue with RFK Jr. and we do about all manner of things, but in this case, I don't think there are many people in mainstream science who would disagree that this is an important area of science. And then when he used the word moonshot, which, by the way, rhymes with another M word, which is money.
Rhymes.
Or at least that's what we think.
Mm-hmm. Yeah. Well, yeah.
Yeah. I'm not sure I know what a moonshot is, by the way.
Well, let's maybe because our reader or our listeners, our readers of the cancer letter will be that's like a trigger word, but the podcast people might not necessarily, like listeners might not necessarily understand like the sort of heaviness of the word moonshot. I feel like it requires a little bit of a history lesson, right?
Yeah, well, we can go through it if you want.
I feel like that would be really helpful, honestly, and interesting.
Yeah, I think the whole term is probably should be abandoned unless but because the moonshot, the actual moonshot,
the original,
the JFK moonshot, not the RFK moonshot, Junior moonshot, the big moonshot
with the actual moon, like the lunar,
the moon, with the actual moon at the other end of the moonshot. At the business end of the moonshot. So that one was really a series of complex engineering problems. The science was not really an issue there as much in terms of like what needed to be done. It was engineering, application, some science. But primarily it was that. And huge challenges, but not something like cancer, which is where the science hasn't been done, needs to continue to be done.
Yeah.
So when people say, "Oh, we're going to do a moonshot," what they really want to be saying is something like, "We're going to project manage this beast."
Yeah. Yeah.
And we're going to emphasize certain kinds of scientific research, and that's actually a good thing. But I think calling it a moonshot is a little bit, it's like what the A-bomb as well was also in engineering, the Manhattan Project, and that's the language that comes to us from 1971. From even before 1971 and the National Cancer Act. Yeah. American exceptionalism, all this. If we do it, we do it. And the National Cancer Act of 1971 is an absolutely wonderful document which does not contain the word moonshot. Does not.
Well, should we talk about the first cancer moonshot?
I don't know what is the only, first. I guess people have been using that language. I've heard it bandied about often, but I mean, Andy Van Eschenbach was trying to set up a moonshot.
Well, there is a successful cancer moonshot, right? I'm learning.
I don't know what's successful. I don't know. I mean, I think we would need to set up we would need to actually look at it very carefully to see what is an actual moonshot and what is a success. Yeah. MD Anderson tried to launch a moonshot, and I'm not even sure I understand what that was. Yeah. There's also Patrick Soon-Shiong was moonshooting. And in fact, there was a point where MD Anderson was suing Soon-Shiong for his moonshot, which was covered amply in the cancer letter. And if anybody wants to do a little dive into history, it was a lawsuit that was abandoned when they had a change of leadership. And then HHS borrowed the moonshot, getting the rights from MD Anderson.
Oh my gosh!
For the Biden moonshot, which is
that's what I was thinking of, was the Biden moonshot. I thought that was the only one.
But I'm not sure in that case that I'm not sure that moonshot really got NCI the money that was everybody was preparing to receive. So I don't know.
Yeah.
What a moonshot is.
I know. I thought that conversation was going to go a little bit of a different way. I mean, it's interesting, but that is interesting. I feel like to to contextualize, like when I was reading your story, it was like, oh, like Biden moonshot was Biden, and to be honest, JFK moonshot were the things in my mind, but I didn't realize there was all of this other sort of like, like history and context with the phrase. But it's interesting because it's like, what, like you're saying, what does this then mean that Kennedy is saying moonshot,
You know what it means? It means that somebody cares.
Yeah.
And somebody wants to make a political statement based on it, which is fine.
Yeah.
Which is why we elect politicians.
Yeah. And I will say, for what it's worth, I mean, this is me just kind of putting my opinion out there, so it could be wrong, just Jacqueline Cobb. But I find it interesting because, and again, I'm coming from being sort of like a wannabe wellness girly. Like if I, like in theory, in my soul, I would love to be sort of like an RFK person if it was, really evidence-based and like equitable, like all of these things. But to me, the microbiome has been sort of this like Maha adjacent wellness topic that happens to have a really strong scientific foundation. So to me, this sort of like moonshot, whatever you want to call it, but like this push for a microbiome research feels to me like, oh, there happens to be this, like almost what you said, Paul, like, there happens to be this overlap where this is something that like the MAHA RFK people find interesting and find important, and it's sort of preventative. It's almost like not holistic, but it's more, it's like less like pharmaceutical, which is, I think, an important point, right? That you talked about, why NCI has to be involved, is that there's not going to necessarily be like pharmaceutical products that promise, profits afterwards, like the typical sort of cancer drug pipeline, right? Like we need sort of federal, or basic, I guess, research into this, right? I read that in your story, right, Paul? I'm not making that up. Yeah.
That was all in there. Yeah.
So it's just interesting to me where it's like, it almost feels like the field is seeing, okay, we have this MAHA leader who wants to focus on this type of stuff. What's like the highest return, subtopic that will actually help cancer patients, right? Like, so that we're not necessarily doing like, we're not abandoning HPV vaccines, and then not having something else to kind of like help cancer outcomes in general. Do you know what I mean? Does that make sense?
Yeah. Well, I mean, I decided,
like I'm saying, this is just my opinion.
No, that's fine. I mean, I just basically looked at it in isolation and for the story. Yeah, because that's what was there. That's what was there.
Yeah.
So what I wanted to do to just kind of separate the politics from the science is sit down with Marcel Vandenbrink.
Yes.
And that's why we did this, who is president of City of Hope, Los Angeles, and National Medical Center. So, and he's also a microbiome researcher who knows who can walk you through the history of it and the science of it. Yeah. And he is kind of one of the reasons that this was done at City of Hope.
Yeah.
So a lot of people who are our readers, a lot of our readers want to know where the money is going and which programs to emphasize. So it was really important to sit down with him and just kind of have him walk me through the science of it and have everybody else walk. So it's part of the story package.
Yeah.
So it's not just pure politics. Political coverage. So, but it is, as someone who's had a lot of training in science, that, this is real science. This is not BS. And yeah.
Sorry, can I'm getting amped. My coffee's coming in.
Yes.
What was interesting, and this was just a throwaway comment. I don't know that I don't necessarily want to like read into it, but Letai at the hearing did mention that the microbiome could be driving, one of the hypotheses, I'm going to try to head just as much as he did, but could be driving the increased incidence and mortality of early onset colorectal cancer, which is like, of course, like I think probably in the lay population, one of the most like prevalent oncology news trends. Like I feel like everybody knows about sort of this early onset colorectal cancer rise. And that's what I know. It's just really interesting because I feel like in our reporting of this, and I think honestly, Sarah and I talked about this on a recent podcast when she was doing reporting on this, when we had the early onset colorectal cancer like issue, we had like 3 stories where we're all just sort of like waiting with bated breath to find out like what is driving this trend, right? Because we're all like, what is it? And it was interesting because Letai, I haven't had the time to like personally go review the literature yet, like we've done our reporting on it, but it's always been sort of like it might be diet related, it might be obesity related, like something microplastic, something, because it just like feels intuitively related to what you eat and consume. And he said it seems like it's probably not obesity related, and that maybe it might be microbiome related. And I just thought that was really interesting because it felt like very new information to me that I've been waiting for, and it happened to be related to what you were talking about. So that, again, just a throwaway comment not necessarily throwaway. That's too harsh.
Not necessarily throwaway because, antibiotics are everywhere.
Mm-hmm. And our meats. Yep.
And people do lose a lot of their microbiome.
Absolutely.
For no reason at all. So that's probably... And its role is not defined, its role in cancer, which is what the rationale is for this clinical research. Call it a moonshot, call it a Mars mission, or call it...
Mars mission. That's a good one. You should tell them. They probably take that up, honestly.
The flight to Pluto. I don't care about the cosmos here.
You could be the marketing people for the administration.
Doesn't interest me, that part of it.
Yes. It's not the point. It's not. That's not what you call it. It's what actually is done.
Zero difference. So that's kind of where. That was a very interesting thing for me to cover.
Yeah.
And it also kind of had an immediate impact on my groceries list.
Wait, okay, what? Are you getting like kombucha and kimchi and stuff?
I've always had kombucha.
Nice.
I've been kimchi deficient for a few weeks, so I went out and bought a big jar, and it's in the refrigerator stinking up the thing.
Love it.
But it's wonderful stuff, and so
making me hungry. Got to go make some kimchi fried rice. Is my favorite. So
No, it's and then just sort of looking at what's in the chicken I buy. Is it antibiotic free or is it not? And those things are really simple to do, and it won't hurt. Hopefully, we'll see. Got to see the clinical trials, right? But yes. But it would be really nice to know what the actual role is, and that is a real scientific question that needs to be asked. It's the reason it was clearly something the administration, or at least Kennedy, wants to do.
Yeah. Well, I mean, I think
he showed up. He showed up in L.A.
Yeah, he was there physically.
For that physically, the only reason more cancer center directors and presumably Letai weren't there is because of the cancer center directors meeting that took place at the same time. And
that'll do it.
Yeah. John Carpenter wasn't there; he was in Washington. So
who's City of Hope?
City of Hope Cancer Center, and as is the case, and. So there was, I could only see one other cancer center director there, and that was Peter Pisters.
Who's quoted in the story.
But mostly they were in Washington.
Interesting. So, hopefully some more reporting coming out of that as well. I mean, is there anything else, Paul, that I feel like we had a nice kind of sweeping discussion of last week's issue, but I don't want to.
The next thing is what happens. So there was this big political thing, moonshot, and
discussion.
All this moonshot stuff. And so what do you do next? What happens next is, I think in the fall, there's going to be an NCI meeting.
Okay. Yeah.
That will be kind of trying to define those criteria of, those goals, and I guess what the moonshot, whatever the moonshot is going to be.
Yeah.
Presumably, it's new money. You would hope it's new money
Yes.
coming in from somewhere.
Yep.
And that somewhere is usually called Congress.
Yeah.
So, yeah, you would hope that would be a part of it, as opposed to some kind of a redistribution of existing funds, but we don't know anything at all.
Yeah.
And we will know. I'm not, nobody should lose sleep over this. It's
not yet, at least.
It's pretty interesting.
Yes.
And we'll be there to cover it, because it's clearly a huge story to do. So here we are.
Yeah, I'm excited, and I think honestly, this is a editorial meeting pitch, Paul. I would love at some point to do like a really, really deep dive into the science of the microbiome. That's my editorial pitch.
Well, let's have an editorial meeting right here and with the whole world watching. Just do it, okay? What would be really interesting to do here? I have this right here. The workshop or symposium at City of Hope. I think I don't know if they're going to set that up on the internet, but there were really cool presentations about the science of the microbiome that exists, and it was selected very nicely by I guess by Marcel Vandenbrink and a bunch of people of City of Hope.
Yeah.
And they were from all over the place. And all of that was really interesting. The one thing that those studies had in common is that they were smallish studies.
Yes.
So, 28 patients here, 14 patients there, but they said something really interesting, but which of course often that happens.
Yes. So true. So true.
Yeah. So what you could do is, and you can bring a team together on this one, is do a story about what the science was. Yeah. And that is worth doing. I think there will be a replay of some sort at that NCI symposium workshop, rather, that's going to be done in September-ish, and we could probably work with NCI to find out whom they're going to invite. That's another way to do it.
There you go.
I think it wouldn't be wrong to put it all together before the NCI symposium. So, or excuse me, the NCI workshop. And so that the questions are going to be raised about it. And you can probably do it as a story about what kind of science should be done. I tried to do that, and I think I did that.
You did.
In my conversation with Dr. Vandenbrink.
Well, yeah. I mean, I'm not going to get us on. We're at a pretty long podcast already, but he did talk about. I know we are having fun. I'm enjoying it. I'm enjoying it. It was really interesting where Marcel Vandenbrink talked about the Human Microbiome Project 1 and Human Microbiome Project 2. And just to circle back to what you said at the beginning of this talk, Paul, where it's like, these are interesting, but it's not in oncology. And so it's like you have like bigger-ish projects, but they're not focused on oncology. And then you have smaller projects where we do have sort of like small trials looking at trials, I guess, studies looking at cancer patients, but we don't have like big numbers in those. So I think there's certainly like a gap in research, but I honestly, more than anything, Paul, when I say I want to learn about the science, I want to learn about like the basic science. Like I want to know how it works, like the mechanism of action. That's what I'm interested in. So we can pause our sort of exclusive editorial meeting. I'll keep chatting, but
we will keep chatting and,
but for everybody else.
Yeah. And in fact, if anybody has ideas about how to proceed,
email me or call me.
Yeah. Calling is easier, probably.
Yes, you can call me.
Just talk at it. But yes, an overview of the science would be definitely worthwhile. And and that is not what I did.
Well, not yet. It wasn't necessary yet. It was the political thing happened first. But yes, this is why you're such a lovely editor, Paul. This is anybody listening. I said I want to do this. He goes, yes.
Just do it.
So behind the scenes on many levels, oncology, the cancer letter, Congress, blah, blah, blah. So
Do it.
yeah. All right. Well, thank you,
No,
Paul.
things are obvious. I mean, that's kind of the beauty of this field, is that you're never short on stories, and there's always massive amounts of things happening, and they're always very, very interesting, and really almost always the people you get to talk to are really cool.
Yeah, and so smart, so smart. Yes.
Enough to give me a complex. All right. Well,
it's a wonderful time to be a journalist. Come on, you gotta say that.
Have a great job.
Yes, awesome. Well, thank you, Paul. Talk to you all next week.
Bye-bye.